Tobago. You know, one of the things that I love about the show, I just love the fact that we got to speak to so many people, so many cross sections. And thank you so much to Jewel Greene-George this morning for our book club corner. Thank you for, highlighting the sons and daughters in the literary space. And of course, we have my next guest, who is no stranger to Brunch, A Taste of Tobago. You see his head poking through right now. Dr. McSween joins us today on Brunch, A Taste of Tobago, and we are going to be speaking on chiropractic adjustments. Now, we usually talk about it. We have been through so much together on this show, but we've never actually seen it done before. Right. And that is what makes today so special. The thing about it is that, a lot of people talk, the talk is cheap, as people say.
Yes.
And so just listening and hearing the explanations and showing the x-rays could be judged as not enough still.
Yes.
For some people who are really skeptical or hesitant, as the case might be.
Right.
So it's so good that we can show what we're speaking about.
Show the actual art of the practice of chiropractic.
Definitely. And how important, because I cannot stress enough how important it is to get to your chiropractor, get your x-rays, get the services
Absolutely important, because without the x-rays, of course, the chiropractor can't do anything, can't work on you. If you go to a chiropractor and do not have x-rays, you're in trouble.
Yes, definitely.
And of course, we're going to see the x-rays. We're going to show how I have to analyze the x-rays before I put my hands on the patient.
Right. And we have a live viewing of that today. Chiropractic care and adjustments, the do's and the don'ts, which is so important because there are so many persons who are claiming to be, healers and physicians and that sort of thing.
And chiropractors.
And chiropractors. And, basically the buzz is on social media.
Yes.
A lot of that influences our decisions.
Right.
So we have to have the right information in order to make an informed choice.
Actually, I saw a guy yesterday with a hammer and a chisel on a patient's back. I thought it was crazy.
Yeah.
And he's actually pounding in the patient's back.
Yeah. And
that's not chiropractic at all.
Yeah. And one of the things that I actually love is the fact that we get to visit this type of conversation.
Yes.
Building awareness is so important. We need to kind of move away and break away from the culture. A lot of people don't want to go.
What we heard about.
Yeah.
What we feel and that kind of thing.
Yeah, and a lot of people don't like going to any practitioner, any medical practitioner of any kind.
Yes.
So we wait, and it gets so bad. And then we hobble in.
Yeah, bend over
to the door.
Can't get up like my patient who's gonna come in here. Feel like the whole world spinning around her. Thursday she came into my office. She wanted to die. I put her on the table to lie down, and oh God, and like, oh no, she started crying.
Yes, it was a whole vibe.
I said, you'll be okay. You'll be okay. Now she can get to bed easy. She can sleep better. And so forth.
All right. So you guys are hearing all the laughter in the background. It's so much pandemonium here on the Brunch show. And, I'm going to give Dr. Mark the opportunity to introduce the next guest that is coming to join us, who is actually going to
be on the table,
and
be adjusted. I'm going to check her. She was with me yesterday because of her condition she has had previously.
Right.
And so I asked her to come in, and she's here with us.
Okay. So at this point in time, we're going to invite...
Mrs. Laville.
Mrs. Laville.
Mrs. Lisa Arthur Laville.
Okay, so Lisa is joining us.
Yeah.
And we're going to undergo, or we're going to at least see, let's put the actions to explanations that we get usually on the show.
Yeah,
all right, so this is your thing. Let me hold the glasses for you.
Thank you.
All right, so this is your thing. I'm going to let you do what you do.
Okay.
So what do we start off with?
Lisa is going to come on the table.
All right, so Lisa, you come this way.
And previously,
just a minor adjustment here, guys. And Lisa is going to do the needful. She's so helpful,
yes.
right?
Yes.
So, Dr. Mark, take us through.
Yeah, now, when Lisa came into me, I mean, she called me in Trinidad and said she wanted to see me. And there was a reason for that. She had a back problem. And when I came up, I saw on my off day again.
Yes.
Because I had to. Her condition was kind of grave. And she came. I adjusted her the first day. And it was a kind of on a trip for you,
Yes, it was.
Lisa. And her complaints was some severe complaints. And so she'll get on my table and I'll show what I do as a chiropractor. Now we have the x-rays, so I want to go through the x-rays and see what I am doing.
Okay.
Okay, yes.
Guys, so in the meantime,
Now, before she gets on the
into
table,
position.
I want to show you something she could not have done before.
Right.
Sit on the table. Lie down on the table. Just lie down. On your back.
Okay,
Could you have done that
so
before?
This was a challenge.
Oh man. I'll have to hold her and she'd be like the whole world is spinning.
Yes.
You know, now she can do that. Now get up off the table. No, the wrong way. The wrong way. Right. She couldn't do that before.
Lisa, don't make Dr. Maxwell buff you
Every day I
on
get
this show.
She couldn't do that before. Now she can.
Right.
Now she knows how to get on the table correctly. So you get on the table the correct way, Lisa.
Okay, so there's the
That's the correct way.
correct technique.
Right. Lie face down for me. Drop your hands.
And this
Now-
is the posture that she should have.
Right.
Yeah?
Now, when I start adjusting my patients, first I try to even them off on the table. So relax, Lisa. And I normally would do this to see how the spine is.
Right.
Now, when I pull on Lisa's leg like this, you would see that the left leg is short. Did you see that?
Yes, I see
you
a
look at
slight
it-
difference.
Right, I want you to look at it. And you see, left leg is short. I'm going to touch her leg. And it's going to become longer.
Oh,
You see that?
yeah, I see it. I see
All
the
right,
difference.
I'm going to touch it like that again. And it's going to become short again. So I know this hip has a problem.
Right.
Right, I can make this leg shorter. I just challenge the leg. And it becomes much shorter. I can bring it down. And it comes to the normal size.
Right.
You see that?
Yes.
Okay. Now, the first thing I do is, when I started giving Lisa care, I had to analyze the neck. So from the x-rays, I have to get into her cervical spine.
Right.
So Lisa, turn on the table now for me, on your back as you normally would. All the way. Good. Now she's on the table. Go down a bit for me, Lisa. Right there. Right. And I would check the neck. Check both sides. And all the place. So yesterday, remember I just started giving her care.
Yes.
Now I'm going to adjust the neck.
Okay.
Now, I've seen the x-rays. I have been analyzing the x-rays since last month, Lisa. Go down a bit more for me, Lisa.
So this is the
Right
X-ray
there.
right here.
Yes. Now, there's another x-ray for Lisa. Right? Right,
This
that's
one,
right. So when I look at this x-ray, I'm looking at up in the cervical spine. I'm looking at from C1, C2, C3, C4, C5, C6, C7, T1, and T2. So the first thing I'm going to do is to check C2. C2 is axis, which is right on the atlas. It's rotated right. So I'm going to go into C1 and C2, and I'm going to move C1. So C1 and C2, they're fine, because I saw yesterday.
Right.
And now I'm going to go at the base of her neck and get into C7 and T1. No, you didn't hear any cracking?
No, I was listening.
Right, so those
I
boards,
didn't hear.
I did put them back yesterday.
Right.
And I'm going to go into C7, T1. And there's a slight movement here. Slight movement. You didn't hear anything.
No, I didn't.
So the neck is adjusted.
Right.
Now, Lisa, get straight up. She couldn't do that before. Because if she did, she'd be in trouble. Right, Lisa?
Yes.
Okay.
So what's the next step?
I'm going into the lower
position?
back. So we're going to look at the other x-ray of a lower back and lumbosacral spine.
Right.
And I'm going to get into two particular bones that usually tend to move, which is L5 and L4. L3 is a compensation subluxation, and L2 is a compensation subluxation. But the problem basically is down in the lower back there at L4 and L5. So Lisa, get back on the table the correct way. Now all this we're going through here, she couldn't do that before now.
Yes.
Now I have just checked the neck, and the leg should be even. You see that?
Wow. Yes.
All right, now I'm going to hit the leg. Just a little bit. So the hip is out a bit. So Lisa, you're going to face me like you normally do. Come towards me. Come down a bit on the table. Right. Stay on your side. Give me your hands. You relax. Don't help me, Lisa. Okay. Bend this leg for me. Now, if I adjust this hip on Lisa, this side, no, don't move, Lisa. You stay exactly, you wouldn't fall. I right here. You know I'm pretty strong. All right? Give me your hands. Just give me your hands. Relax. On your belly.
Right. So
On your
walk
belly.
us through what just
What I just did
happened
is
there.
I moved slightly because I said I adjusted it yesterday. L4 and L5. Now all this she's doing here she couldn't do before. Eh?
Right. Like moving
It's
and
trouble.
adjusting on her own. Yes.
Okay. Now, you didn't hear any set of cracks.
No, I didn't.
Right. Like the first reel we had when we started this thing. So I'm going to pull on her legs. Relax, Lisa. Legs are even.
Oh yes.
Right. Now
Nicely.
if I challenge her leg, if it's not even, it should go back up. Didn't go back up.
Right.
If I challenge the leg again, it should get longer. It didn't. So
It's even.
it's even. One of the things I usually tell my patient is that before you get off your bed, turn on your back. Turn on your back, Lisa.
So she's able to turn.
Oh yes,
her
oh yes. She is retro.
So that's progress.
Oh my God, she's retro doing that. Right?
That's progress.
A day she nearly made me cry. All right. So I pull this leg up, Lisa. Hold your knee. Pull it towards you. And I say, before
Right.
you get off your bed, stretch your lower back a bit and your hamstring. So she's going to count 10. And she's bringing this down. Bring this one up. She's going to count 10. Put it down. And she's going to bring up both legs. Hold your knees, Lisa.
And hold, yes.
Good. Put your legs down. Every morning. And in the evening before she retires. Now, if I told Lisa before to get up like this is trouble. Get up the bad way, Lisa. I'm here, you're not going to fall. Now she can get up.
Right.
She couldn't do that before. And she's near to perfect now. All right?
So how do you feel, Lisa? You feel, you know, because you have more range of movement. Now, how does that feel for you?
It feels quite, it's different. You can tell that something has happened.
Right.
Before, my head used to feel, well, other than the dizziness, extreme. And this is not just like dizziness that you're walking and just, this was a rotation. I could actually count the number of circles that rotation would make.
Right.
By the third day, that had stopped. The third adjustment. My brain, it seemed like if blood was flowing to my brain. My stomach issues eased. I was having pains in my heels, my knees, my ankles were swelling, and all of that has subsided.
And you had a problem breathing too.
Yes.
The first day, just you can breathe better. So, wait a minute, I can breathe. I can breathe. So chiropractic is just what you saw. You know, it's not like a Mack truck hitting you, but you must analyze those X-rays to do what I just did. I could not put my hands on Lisa if I didn't have those X-rays.
Yes. Because you have to be guided on what needs to be fixed. So
And the
if you could
X-rays?
stand
The X-rays guide you.
just so we could see, because she looks so much more comfortable now. You know, so much more. You know, I mean, the range of movement is definitely increasing.
Yeah, because it affected even how I walk to go. Like I have my own business, and so even to go into do clinicals, I couldn't go into attend to clients.
Right.
I would be taking painkillers to go to do a massage or facial. Even my events jobs, I had to back down because it was painful to execute. Every joint was hurting, not recognizing that it was relating to my spine.
That's fine.
Yeah.
And when did you start visiting my good friend, Dr.
On the
Mack here?
29th of October.
29th of October.
Yeah.
Actually, it's a month.
Yes, it's a month. And this happened, I came back from a business trip from overseas, and the day after I arrived, everything was fine. This Sunday morning around 1 a.m., I got up and I felt the slight dizziness. It happened again around 6, and then by 10 o'clock, it was a whirlwind. That sent me to my general practitioner. She suspected that there was something wrong with my spine during the COVID period and advised me to get some help, but they wouldn't do x-rays at the hospital. I tried to get it done privately. So I knew that something was up with my neck. But when that dizziness started after that trip in September, it was serious. It was serious. And so I contacted him, got the x-rays done, and the rest is history.
Yeah. And you know, one of the things that I love about Dr. McSween, he doesn't do anything without explaining. So it's like, okay, I'm with you every step of the way. And that is what, at the end of the day, that is what you need, because you need that comfort. You need that easy flow of conversation to happen as well, even if you're the patient and you're not the professional here. Just for your peace of mind.
Yes.
You need that flow of conversation.
I remember saying to him that I thought something was growing in the back of my
Yes. He used to get a pain in the back here.
Right, yeah.
So I thought something was going on here. Now, as a massage therapist, we are not trained to touch bones. We avoid bones in massage therapy. We deal with tissue and muscles and tendons.
Right.
So nothing that I learned from my profession could tell me what was going on. There is not until he got the x-rays and he explained, okay, you have some movement here and you have some calcium deposit here. Step by step, everything from my head, my neck, my clavicle. He was able to look at the x-ray, and I'm looking at these x-rays and I'm saying I would not have been able, I'm not a professional with bones, so this is like night and day after the treatment.
Now it took some doing now, working with Lisa, because I left Tobago, went back to Trinidad, and she had to come down to Trinidad. She came down to Trinidad. How many days I saw you in Trinidad?
3 days.
So 3 days she came back up. So she is much improved. And now I've seen her since I came back. She's like 90%, 95% good.
Yeah, and the range, because this is so important, the range of movement. We take so much for granted because I'm listening to you speak, and basic things, basic movements of our bodies we take for granted until we are compromised.
Comes down on you like a
And then,
bricks.
like I said, we hobbling and we limping, and we coming in to see Dr. Max.
Yeah. Well, I'm here. I give you my service.
Yes.
You know, and I tend to feel that I'm pretty good at what I do.
Definitely. I love the fact that you aren't afraid to tackle any topic.
Oh, not at all.
And so there is that what you hear is what you see is what you're gonna get, first of all. And what you're gonna hear is the truth.
Yes.
And we need, as patients, as clients, we need that comfort.
And I mean, I appreciate my doctor because it means that she has studied what compromised spinal issues can cause in the long run.
Right.
So she directed me. And as I said to him, I used to look at him for years on the previous station and here. And it's because of him I stopped using regular pillows. I would go to the baby pillow. Now I'm on a towel girl. He has me sleeping on a towel.
Yes.
But it feels good because of the issue that I have.
Right.
So at the end of the day, if you have to go get the x-rays, you need to go get them. It's important.
Definitely.
Because that explains to you, you're able to see and identify with what's going on.
Yeah, one of the things that you must understand too is Lisa has what is referred to as cervical spondylosis. She has lost some of the curve in her neck, and the bones have moved. And there's a bit of some osteophytes here and there. But the real issue there is the movement of those vertebral bodies. And they move, they rotate, they go posterior sometimes, and it's trouble.
Definitely. And we always love having you, but we are out of
Hey, thank you very much. I'll be back next month.
Yes, so we thank you so much. Thank you so much,
Welcome.
Lisa. You're an awesome patient today. Thank you for your debut on Brunch, A Taste of Tobago.
She's a good patient,
Yes.
trust me. Not a lot of patients
And
like that.
yes.
They feel a little good and they're going to do the wrong thing. I tell her, listen, don't go down in the craters we have in the roads there. Don't go over the bumps.
Yes. So we thank you so much, Dr. Mark. Always
Welcome.
a pleasure. We're going to take a break. We're going to be right back, guys, with more Brunch, A Taste of Tobago. Please stay with us. Do not go anywhere. You know I love you, and I thank you for staying. So we're going to be right back with more Brunch, A Taste of Tobago.